Good afternoon, and welcome to today's webinar, Address Clinical Workforce Challenges with DirectShifts On-Demand Workforce Management Solution, which is brought to you by DirectShifts. DirectShifts is a healthcare workforce platform, our marketplace, and management solution services provider. We partner with health services providers to efficiently and cost-effectively meet their workforce development, planning, and management goals. Our tech-enabled services help hospitals and health systems streamline recruiting and hiring, from initial job requisition through sourcing, applicant tracking, credentialing, onboarding, training, scheduling, time management, and ongoing performance evaluation and improvement. We help reduce reliance on expensive travel clinicians with our local first sourcing model. We help lower dependence on healthcare staffing agencies and their associated fees with our flexible, transparent pricing that includes zero placement fees and conversion fees. And lastly, we help manage and optimize the entire clinical workforce of our partners, not just contract workers, but their on-demand workforce and FTEs. Today's presentation will provide a brief overview of the current state of the healthcare labor market, a summary of clinical float pools, their benefits, their potential to address issues facing healthcare workforce development, and challenges associated with the traditional float pool model. Next, we will summarize DirectShifts' modern, tech-enabled, on-demand workforce management solution and how it addresses the shortcomings of traditional float pool models and the overall value our solution can provide to our partners in healthcare and health systems. And finally, we'll demonstrate how our solution addresses a few common workforce management use cases before fielding questions from the audience. And now, it's my pleasure to introduce today's speaker, Matthew Gang. Matthew is DirectShifts Vice President of Growth. In this role, Matt successfully delivers DirectShifts solutions and services to our healthcare partners, including sourcing, recruiting, credentialing, onboarding, training, and customer success and support. Matthew has extensive knowledge in building high-growth businesses and scaling operations, and he is passionate about helping our healthcare partners and clinicians reach their goals. So without further ado, I'd like to turn today's presentation over to Matt.
Thank you, Jake. Thank you for the kind words. Thank you for setting the stage and laying out the expectations for everybody for the presentation today for today's webinar. As Jake had mentioned, the idea of today is to not just tell you about how the float pool works, but to really dig in using historical data and marrying that to the current situation and the current playing field in the healthcare industry today. So, hospitals and health systems want to reduce their reliance on expensive contingent labor and travel agencies. We thought it'd be wise to give some insight into these numbers to quantify what has gone on since the beginning of COVID and previous, to how things have changed, how the playing field has changed, and where things stand currently. So in the annual cost of caring report, the AHA, American Hospital Association, has reported, number one, that hospital labor expenses have increased 21%. This is primarily due to the heavy reliance on contract staffing agencies. As we've seen, while the seasonal fluctuations in patient census has occurred, there's also increased competition in the market. These two things, when they're married together, of course, drive up the price with any business, but of course, in particular to a business where patients' lives and the health of patients are at stake. Number two, the contract labor expenses overall are up 258% from 2019 to 2022, which, when you're looking at it, is a significant driver. We like to see how hospitals and health systems are trying to re-normalize the market, but during the pandemic, I think everybody's been on the same page with realizing that this shortage of clinical staff is here to stay. It was existent before the pandemic, I think the pandemic shined the microscope on this problem, and we're here to help try to normalize the market, normalize the playing field, and do right by our clients and our clinicians at the same time. Unfortunately, the supply side of the healthcare labor market doesn't support the priorities of health administrators. There was a report from McKinsey done in September of 2022 that reported 31% of nurses in clinical settings that perform direct patient care are likely to leave their role. Why is that? A lack of work-life balance that relays into an unmanageable and very stressful and tenuous workload, an unsafe working environment, and an unflexible schedule. When you group all those things together, you kind of understand why that's 31%. But at the same time, and as we'll get to in a short minute, you'll see why these on-demand float pools could be a solution to offset an issue like this. So getting to the subject of the webinar today, float pools, on-demand staffing pools. Over the years, as you can see, this isn't anything new. They've always undergone different names, and different organizations have different names for such a solution. But what are on-demand float pools? We look at float pools as a way to provide benefits to both sides of the equation, to the organization or the healthcare system, and to the clinicians. From an organization perspective, it's a way to control costs and be fiscally responsible. You're able to increase the morale of staff, which in today's day and age, to reduce burnout and increase morale, it increases culture overall. By doing this, in turn, the nurses who are providing this direct patient care that I previously alluded to on the last slide are able to provide better care. They're able to uphold higher standards and create more positive outcomes to ultimately keep patients out of the hospitals. From the clinician side, the benefits, like I just mentioned, less burnout, less stress, which then in turn increases flexibility and a work-life balance. By increasing this flexibility and work-life balance, it has the trickle-down effect to all of the other smaller but still important factors that go into somebody's employment arrangement. Of course, in healthcare, as it is with any factor that goes into it, whether it's clinical trials with new medications and drugs, or staffing solutions, or patient care solutions, everybody always looks for that silver bullet, that one solution that's able to fix everything. Unfortunately, of course, that's not possible. But what we can do is try and understand the problems, understand the challenges, address them, and create solutions or create plans of how we can solve these challenges or how we can overcome these challenges. From a clinician standpoint or a clinical standpoint, the clinicians have to be able to float to different departments, float to different areas, be able to be a team player. So much of healthcare and direct patient care is done independently. You have the nurse who is giving drugs at 3 a.m., at 7 a.m., around the clock. It's not always easy, and there's a lot of alone time. It's a very lonely practice sometimes. So being able to adapt to different units, help out where need be a team player is extremely important. By being that team player, again, it'll help increase culture among your other coworkers and provide that job satisfaction, which in turn would reduce burnout. The process. What are the challenges with the process? Being that everybody has their different connotation with how to deploy a float pool, making sure that there is a uniform, understandable easy way to deploy a float pool or an on-demand pool is extremely important. By creating this uniform process, department to department, all leading back to human resources, and with the technology company that's enabling it, it creates a winning outcome for all parties. Third, as I just mentioned, there's the technology. What's out there now? What has currently been used to help manage float pools has been limited with its customization, and there's been limited integration. All different facilities, whether they are archaic with regards to their technology or more modern with regards to their technology, everybody is looking for what is the next best thing to help make their lives as administrators easier. That's why, from a DirectShifts perspective, as I mentioned in the beginning, we try to understand, listen to feedback, and not be a one-size-fits-all solution. So here's where the solutions for the on-demand workforce management come into place. And I just want to take a second before diving into this and just dissect on-demand workforce management. And I think this is a good point, and I think it gets lost a lot in today's environment. Staffing is one piece of the equation. Sure, you can speak to a hospital administrator, listen to what their needs are, give them someone who might fit the skill set, and back off. But there's so much more that goes into the day-to-day employment arrangement between a clinician, somebody who is working with patients, in some cases saving lives, and the facility in which they're working with. The solutions, one, for the clinician, on our end, we make sure that we are first and foremost sourcing local candidates who live in the area, who understand the community, who understand the patients, and who want to give back to the community. By doing this, there's a sense of pride, there's a sense of accomplishment, there's a sense of giving back, if you will, to the people who you interact with and see every day. To take that a step further within our float pool that we power, our clinicians are pre-vetted, verified, and pre-credentialed. We want to make sure that if a need is open on the facility end, we are able to be as efficient and timely as possible in making sure that that nurse, that physician assistant, or that doctor is able to start seeing patients and working at that facility as quick as needed. Second, the process. How is this all going to work? Where does it start? Where does it end? Who are the key players involved in between? The way that we like to go about things is looking at it from a tiered perspective. First and foremost, you have the permanent staff of the facility. Those are the people who have more likely than not been at the facility for years, understand the culture. They're part of that fabric at the hospital, at the healthcare facility. That creates stability. The next option after that should never be the extensive travel staffing option. That's where we like to come in from a workforce management float pool perspective. By having this float pool in between the permanent staff and the expensive travel nursing, we are able to test the market at lower rates. And by the chance that we're not successful, that allows us to open it up to other agencies and other companies that are involved to make sure that we're serving our clients and that they're getting their spot filled. Because at the end of the day, it's always a team effort. The third piece is tying it all together with technology. How do we match not just the right person to the right job, but the right clinician with the right skill set to the right position that's needed, or to the right skill set that's needed to treat a specific subset of patients? When you have that, and we're able to take care of that effectively through our AI matching system, we're able to make this process a lot easier. Furthermore, as we were saying previously, workforce management, it's more than just staffing. You have credentialing, making sure that all of the documents and licenses are active at all times. You have the contracting portion, making sure that all parties involved understand what the intricacies of the contract are, what the pay is, what the comp is, and what the time frame is. And last but not least, onboarding. These are folks that are taking jobs at hospitals, and just like any job, it's how they provide for their family and put food on the table. Our smooth, efficient onboarding system is able to take care of things very efficiently in order to make sure that everybody's on the same page. Post-employment, after somebody has, or a clinician has started working or gone into the facility to start seeing patients, we help with scheduling through our new scheduling module, timesheets in real time, and payroll. To take that a step further, there are, of course, always announcements, always intricacies on a day-to-day basis that must be relayed or communicated to the clinical workforce. And through that, we're able to send real-time notifications and messaging or deploy messages to the active rosters for each clinician or for each facility. By doing that, once again, that keeps everybody on the same page. Going back to the scheduling portion for a second, I want to make sure that we highlight this, as this is a feature that provides a ton of value to a lot of our current clients, and we know will provide value to some of our potential clients that are on this call today. Our shift scheduling module really operates like a true on-demand marketplace. From a facility end, whether it's a nursing manager or whoever the operations director that handles schedules at a facility might be, they're able to log on, go to our shift scheduling module, and put in open shifts. They're able to put in the bill rates, tie it to a job, and make sure that this job gets deployed correctly to all of the clinicians in the float pool. Who are the clinicians that are deployed in the float pool that are able to see these jobs, though, or to see these shifts? It is not open to just anybody and everybody. We make sure, along with the facility staff, that these folks are interviewed, that they're credentialed, that all of the I's are dotted and the T's are crossed, just like any other staff member or travel nurse or clinician would otherwise be in any other type of arrangement. Only then will they be allowed to see these specific open shifts at the respective facility. To take it a step further from a credentialing standpoint, if a document or a license were to expire or lapse, our platform has notifications to red flag that clinician and make sure that that document is renewed or reactivated in order for that clinician to be able to pick up shifts again. One other thing I'd like to touch on with regards to the shift scheduling is the dynamic pricing. While it can be done automatically, it can also be done manually. And by that, to give an example, if you see that your facility is having trouble filling shifts on the weekends, it's possible that for the same job during the week, you can bump the rates up a few dollars on the weekends to try and fill shifts more effectively. If you see that your night shifts are in need of clinical staff as compared to your day shifts, just like the weekend example I just gave, you're able to bump the rates up a little bit to hopefully attract more clinicians. Make sure that those shifts are filled and make sure that the patient ratios are remaining at a level that makes it feasible for the clinicians to do their best work. To tie it all together, there are positive outcomes that are generated all the way around by using the float pool. Here, I want to touch on just a few of those. First and foremost, the float pool is used to remain fiscally responsible and reduce costs. By utilizing local staff and people in the area, clinicians in the area, we're able to come in at a lower rate that helps facilities lower their rates overall and allows them to be more predictable. Number two, reducing burnout and turnover. The idea isn't to just continue to use the same staff over and over again and use them in a capacity in which they're working 48, 60 hours a week and accruing overtime. The idea is to keep everybody fresh, to create an environment where everybody wants to come to work, treat patients, and support the community. By utilizing the float pool, it allows you to avoid those unnecessary overtime costs, have the right amount of clinical staff, and be able to drive those positive clinical outcomes for the facility and for the patients, which leads to the next point: patient safety and those positive outcomes. The goal overall is to be a partner to our facilities. As a partner, we take it personally, just as the facilities take it personally, to keep patients healthy, to keep them out of the hospital. The way to do that is getting to the core issue as to why these occurrences continue to happen. By providing an adequate level of staff and making sure that there are safe nurse to patient ratios, we're able to do our part in making sure that we're driving positive clinical outcomes. By grouping everything here together, overall, it improves the financial performance. From a bottom line perspective, it reduces the costs on the bill rate. From a top line perspective, it allows us to see more patients and create those positive outcomes, as I just mentioned, to keep patients out of the facility. Now I want to jump into a couple of quick slides, situations that we've seen occur among some of our clients, and just talk those through, explain them, as we see that these are situations that probably occur at the majority of facilities that we work with. The first one, last minute open shifts. What if, per se, a nurse in a med-surg unit or a nurse in the emergency department calls out and the emergency department is overflowing with patients that evening? This is a great situation where our shift scheduling module can be utilized. First, again, as I mentioned previously, you would log into the DirectShifts platform. You would go to the scheduling module. You would be able to input that shift by clicking the Add Schedule button in the top right-hand corner, where you would be able to set the time of the shift, the occupation, the specialty, and the bill rate. The bill rates are able to be set dynamically, but also manually. If it's close to the time from when the shift starts and you want to give yourself the best chance of making sure that that shift is being filled, maybe you bump the bill rate up a couple of extra dollars. Maybe there's other things that you can do to provide the clinician with all of the color that they need in order to make sure that they make a decision and see the shift so that they're able to make it on time. When a shift is put into our shift scheduling module, it gets shot directly to the clinician's mobile, DirectShifts mobile application. When they receive that notification on their end, they're able to, at the spur of a moment and the push of a button, confirm that they're available for the shift or deny that they're available for the shift. As I mentioned previously, the ability to either propose or reject is just left up to the people that are, or the clinicians that are entered into that float pool. It is not something where this is going to be opened up to any and every clinician, and it's going to open the floodgates. You know that the clinicians that are seeing these positions are vetted, verified, credentialed, understand the EMR and the processes of the facility, and know that they could be relied on to adequately treat the patients. Once again, going back to what I had just mentioned, once a job is proposed by the facility to a clinician, a notification gets sent to the clinician. It appears something like this, where they could simply respond to confirm the shift or decline the shift, pull up the shift scheduling module in their mobile app, and maybe message with a recruiter or clinician partner if they're interested in finding out more information. Scenario 2, avoiding unnecessary overtime. I know I had previously mentioned this as a solution. The float pool and the reliable clinical staff that is entered into the float pool is able to help you recognize trends and be proactive rather than being reactive. To give an example, it's currently middle of July. Obviously, flu, COVID, RSV season last year started at the end of September and the beginning of October. Being at the point we are at now, we have clients that are asking us to be proactive in setting up these float pools to make sure that when the time comes, they have the staff and the outcomes necessary to reach out and make sure that they're able to meet the demands of the patient census that they're seeing at hospitals.
On behalf of DirectShifts, I just want to thank everybody who took the time out of their busy schedule to join us for about 40 minutes to learn how we're trying to disrupt the workforce, healthcare workforce management landscape. And again, have a great day, and we will be providing a follow-up email with the recording, slide deck, and a brief survey to get your thoughts on today's session. Thank you again, and have a wonderful afternoon.
Thank you, everybody.